It is a pleasure to have the opportunity to introduce our distinguished guest speaker, Professor Fatma Al Mulhim. Professor Fatma Al Mulhim is a consultant radiologist at the head of breast imaging unit at King Fahd Hospital University. Professor Mulhim is the Deputy Chairperson of Arab Board for Medical Specialties in Diagnostic Radiology, as well as the founder of Breast Cancer Early Diagnosis Committee and a Shargiah Wardiah campaign at the Saudi Cancer Foundation. Professor Mulhim is the founder of It Doesn't Know Later campaign at Dammam University. She has published over 50 scientific research in national and international journals and participated in writing 5 published medical books. In addition, Professor Mulhim published many educational material concerning breast cancer awareness with special prints for the blind. Today, Professor Fatma Mulhim will speak about breast cancer advocacy in Saudi. Welcome, Professor Fatma Mulhim.
بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. Good evening, everybody. Please allow me to express my gratitude to the organizing committee for their good organization, and special thanks to Dr. Rula for giving me the chance to be part of this very important meeting to our people in Gaza region. I'll present today breast cancer screening in Saudi Arabia. We all know that breast cancer is the most common cancer in the world. It's impacting about 2.1 million women each year, causing great number of cancer-related deaths among women. In 2018, it is estimated that almost 6,100 women died from breast cancer, which is approximately 50% of all cancer deaths among women. Breast cancer rates are higher in more developed region. However, rates are increasing in nearly every region globally. In order to improve breast cancer outcome and survival, early detection is very important. What WHO saying? According to WHO, the estimated number of new cancer cases each year is expected to rise from 10 million in 2002 to 15 million in 2025. And 60% of these cases will be in our region. Cancer almost kills 270,000 people in our region. In addition, the largest increase in cancer incidence among the WHO region in the next 15 years is likely to be in the Eastern Mediterranean region, in which the projection modeling predict an increase of between 100 and 180%. So what are the recommendations for our region, the Eastern Mediterranean region? The recommendation supports, the IMRA supports, endorses the promotion of people education and awareness about breast cancer in most countries, regardless of their resources level. And this is very important. Does not mean you don't have resources, we cannot start. No, we can start with different modalities. What is the position of WHO position or paper of mammography screening and the guidelines? We all know that survival relates directly to the stage of diagnosis. And in this paper, it shows that survival is very low in areas where there is no early detection, where it is really high in areas where there is a screening program and they provide a good treatment. So in this slide shows that survival directly related to the stage at diagnosis. We all know that breast cancer screening will not prevent breast cancer. However, it can help find breast cancer early, and at that stage, we can treat it easier. Morbidity caused by the disease and treatment is also reduced with early diagnosis. And it shows most of the publications that prompt annual screening mammography reduces breast cancer mortality by 15 to 50%. However, we should not forget the papers talking about radiation exposure, overdiagnosis, false positive biopsies, and false negative exams. So the most important screening recommendation are three: screening mammography, clinical examination, and self-breast examination. And we should not forget that there is a lot of controversy around these three most important things. Regarding screening mammography, there are a lot of organizations have their own guidelines for screening. And even in the same area, like in Europe, there is a lot of difference in the screening program, and that depends on the cultural as well as the money spent on the screening program. However, we are talking today only about average risk women. Ladies with high risk, like dense breast, early age, or hereditary cancer, should be treated separately. Clinical breast examination, also there is a lot of controversy about the importance about it, and also breast self-examination. As we know that breast self-examination will not affect the survivor. However, in our region where there is no screening program, we still teach the ladies how to do the breast self-examination. In this slide, you can see that there is different recommendation for screening program. However, the only constant thing is the age of starting the screening. There is no single recommendation recommend starting before 40. And people with a special high risk, they have, as I said before, their own special protocols. What about Saudi Arabia? We have the Saudi Cancer Registry, which is established in 1992, and it is the first registry in the Middle East which reports on national survival data. Breast cancer, as the rest of the world, it's trying to be the first among female. It accounts around 70% of all cancer reported among Saudis. 30% of all cancer reported in Saudi women are breast cancer. The ACR is 24 per 100,000, and the median age is 50 years. We can see here that mortality is around 8.9, but you know that Saudi Arabia is a huge country. So the main problem here, we have regional differences in the incidence at the ASR for each region. If you can see Saudi Arabia, the ASR is around 24 per 100,000. However, there is a different incidence in the region. We have 13 regions where the Eastern province has the highest incidence, approaching now to 41 per 100,000. We're starting the campaigns for early detection of breast cancer in 2004, and at that time the first report came that the localized stage for breast cancer account only in 13.7%. However, after almost 13 years of hard work of different really institutes in the kingdom, we see that the localized stage goes up to almost 38%. So what are the problems of breast cancer screening in Saudi Arabia? We know that the breast cancer is the commonest type of cancer in female. Incidence is really increasing according to the reports. Patients usually present at more advanced stage than the areas where there is a good screening program. We have regional differences in the incidence of breast cancer. Survivor is lower in solid tumor as compared to developed countries, and the majority of breast cancer represent the patient between the age of 40 and 50 years. In our community, breast cancer is a taboo subject that is difficult to talk about, even with their immediate family. Many Arab women find it shameful and embarrassing to discuss breast cancer. However, this is our culture. We cannot change anything. And it is very, very common for the majority of women to refuse to talk about it. They do not want to talk about it, and they keep it to themselves. It is a taboo issue, and some Arab women, even when they start to talk about it, they don't feel really comfortable. I tried to just do a survey about publication regarding publication regarding screening. And I do find most of these publications at that time, when we started publication in the kingdom, talking about the low intake. So there is really a problem on ladies coming up for screening. And this is one of the papers only talking about the rate of increase, and that there is a definite increase in breast cancer to threefold in the most recent years. And the causes mostly due to change in lifestyle. So why the low uptake? There is screening program are next door, however, the ladies are not coming. It is due to lack of education and awareness among the ladies, and most importantly, lack of encouragement by the physicians. So we have to educate the physician to start to referring patient at the age of screening. And earlier studies from different regions showed that the ladies does not know the basic knowledge about breast cancer and the common risk factor. Other studies conclude that the unavailability of national screening program make the ladies does not trust those different activities all around the kingdom. So what we should do and what we are doing, we have to increase public awareness. And the approach of education, we style it according to our culture. First, we have to say that we all support the right of all women to be educated about breast cancer, and the education, as I said before, it should be culturally adopted, and you should not talk to them with different about different culture, the different atmosphere. You should tailor your education program in a language and in a way that should be acceptable to your community. The point we stress in our education program that breast cancer kills. However, breast cancer, if detected early, it will be effectively treated. We teach them the signs and symptoms about breast cancer, and we tell them that 80% of breast lumps, or what you found in your breast, most likely to be benign, so don't panic. And breast cancer is diagnosed by a biopsy, not by mastectomy. And that, unfortunately, most of Arab ladies, they think if they have breast cancer, it will end by mastectomy. We used all type of medias, all social medias to spread the word about the importance of early detection. We had special booklets, and I have a special booklets made especially for the blind ladies to have the chance to be educated about breast cancer in Braille. In 2013, there is they established National Breast Screening Program. They follow the ACR guidelines. However, it's mostly concentrated in the middle region. We have a lot of problems within this program because there are other areas they serve or they give screening programs. So there is lack of communication between these institutions, and no definite link between them. They don't follow the same guidelines, and at these also programs there is low uptake. Unfortunately, most of the programs served in Saudi Arabia, they do opportunistic screening rather than organized screening. So in conclusion, breast cancer is a problem in Saudi Arabia as in the rest of the world. We need good coordination between the primary care clinic to secure referral of ladies at the right age, and also to identify the ladies at risk and refer them to the proper protocols. We have to educate the educators, and it is very important to start with the basic healthcare provider. And for our region and Arab region, either the OB/GYN doctors or the primary care doctors. So we have to educate them about the importance of breast screening, early detection, and about referral the ladies at the right age. We have to increase public awareness about the importance of early detection and tell them if we early detected, we can treat it, and all those what they hear in the media about the complication of breast cancer, mastectomies, and all of these things. We have to show them that early detection will lead to survivor and better outcome, even in treatment. And there is a big need for research in our region, in Saudi Arabia and in our Middle East region, to identify the risk factors and to see if really we have a problem of young age presentation, and why the breast cancer is increasing in our region. With this, I conclude my talk. Thank you very much, and best of luck for the rest of the speakers. Thank you, Dr. Rola. Thank you, everybody.